I think the best thing about them is that, we can tailor them to women's needs because I don't think two women have the same experience in menopause. Menopause can affect you head to toe, and perimenopause is sometimes the worst because the hormones, not only are they going towards depletion, but they're also swinging.
Welcome to Suburban Warrior, the podcast that will impact, inspire, and empower you to transform your mindset and become the badass warrior that you are. I'm your host and fellow warrior, Chrissy Pfeiffer, former clinician and corporate marketing exec turned multi-passionate entrepreneur, performance and life coach, and mom to 4 not-so-little warriors. Each week, I will bring you honest conversations with inspiring guests to share their stories of resilience, optimism, success, and simple yet effective strategies so that you transform your thoughts and change your behavior to get the results you want in your life. You will be empowered to take action, warrior up, and believe in you. Let's do this. What's up, warriors? Welcome back to another episode of the Suburban Warrior Podcast. I'm your host, Chrissy Pfeiffer, back this week with another amazing suburban warrior here to share her story and expertise with us. And guys, I'm so excited for this episode this week because we are talking to one of the most amazing physicians. She focuses specifically on menopausal care. So without further ado, let me introduce to you Dr. Marialisa Lambert. Dr. Lambert provides routine gynecologic care and is a board-certified obstetrician gynecologist. With a commitment for addressing menopausal health, Dr. Lambert applies holistic techniques to traditional practices, using vitamins, nutrition, hormones, and lifestyle management as guides in her principles. Throughout her 24 years of practice, Dr. Lambert has developed an alternative approach to menopause, which utilizes bioequivalent hormones while incorporating other tailored methods, such as diet and exercise. Dr. Lambert's philosophy has always been to offer comprehensive and compassionate care that is customized to individual needs. She believes in treating the whole person rather than isolating the illness. She examines her patients' extensive histories and collaborates with them to offer a wide range of treatment options, allowing her clients the opportunity to select a treatment plan that best suits their personal preferences. Dr. Lambert also has experience in training in functional medicine for illnesses such as irritable bowel syndrome, fibromyalgia, and chronic fatigue. She has developed various treatment plans for weight loss and anti-aging programs. Welcome to the podcast, Dr. Lambert. I'm so excited to have you here.
Thank you for having me. And thank you so much for getting the word out.
Yes.
And we're here to talk about hormones and menopausal health, and we don't have to suffer. And that's just breaking news for most women.
Right?
It's a shame. So it's thanks to you and Dr. Mary Claire Haver and other people who are out there with the social media getting the word out. And I'm happy to be here for this reason.
Yeah. I'm sure it's sort of interesting for you because you've been in practice for over 24 years and really specifically been treating menopause for many of those years. So for you, it's not anything new, but the word needs to get out, the options that are available to women. I feel like it's this whole new world that we're sort of embarking on. And I am very passionate about it because of my own perimenopausal and menopause experience. And I'm thrilled to have you here so that we can sort of dispel some myths and really get down to it. So why don't you first tell us a little bit about you, who you are, how you got into being a specific menopause care physician. Give us a little background.
Well, I was really fortunate in my residency training. That's the specialty training for becoming an OBGYN after med school. And we had a lot of, even in those days, of course, most of the professors were men. But we had the fortune to have a female lecturer who, she was in with us in the clinics and happened to be one of the authors of the studies that came out in the 80s and 90s showing all the benefits of hormones to women's health. And she was one of the early researchers. So she was just sort of embedded with us in the clinics and so on. So we got a great background just having that exposure. But then after residency, she happened to be on the floor above me in the office I was working in and needed extra help. So I would just go up there. I was a young doctor in my 30s, not knowing about menopause much, but just sort of got inundated. And people would come from up and down the East Coast. We were in New York City.
Yeah.
So people would come from Florida looking for some help.
Yeah.
And so, even back then, menopause specialists were few and far between. But also back then, before we had all these medications, like now we have things to lower cholesterol and for osteoporosis. Back then, we didn't really have these things. Antidepressants weren't even a thing then, just the, major depressant medications that psychiatrists prescribed in hospitals. But we didn't have, all these prescription meds available, and hormones were found to reduce a lot of those symptoms and helps protect the heart and the mood changes that happen with menopause. So anyway, back then the hormones were really accepted and promoted for those uses.
Yeah.
But then we were also using a very, let's say, artificial form of estrogen and progesterone. They were pretty strong, and they've been in use since the 1940s, actually. But they gained a lot of popularity in, I'd say, the 80s and 90s, because women weren't just, not that housewives don't work a lot, but women were in the workforce and didn't want to just retire. And when they went through menopause, a lot of them felt like retiring, and it's hard to get that get up and go and motivation. So they were looking to the hormones to keep them going and keep them going strong and as usual. So so that was a little background history for how popular the hormones were. Like the prescriptions written were over 60 million a year. And they were backed by the big pharmaceutical companies.
Because they were making women feel so much better.
So much better.
Right?
Yeah. They had so many different purposes.
Yeah.
With, protecting the heart and the bones and so on, and just making you feel so much better.
Yeah.
But then there was a big research study on that specific hormone, the combination Prem-Pro, that showed there was a little association with breast cancer. And that was all everybody needed. And so they just stopped teaching about it in med school. They didn't pull it from the shelves because the actual risk was extremely small for the association with breast cancer and the combination estrogen progesterone. And now they know that it was just really the progesterone part that was synthetic, because that one did have a slight risk, like it's less than 0.1% increased risk associated with breast cancer. The estrogen part of it, called Premarin, did not. That actually had less instance of breast cancer.
Right. And Premarin back then wasn't even like a bioidentical hormone, right? It was a synthetic hormone.
It was a strong horse.
Which is different than even what, right.
Yeah.
And which is different than, even what is available now for women. And, that whole study really just took us, it really took out an entire generation of women from receiving hormonal care if they need it during menopause, which not only would have helped with their menopausal symptoms, but to your point, a lot of the protective symptoms, or protective features for the heart and bone and all that sort of thing. So, which, is very unfortunate. But I just heard something that said when the results from that Women's Health Initiative came out, there was like megaphones, like the media picked it up. It was on every news outlet. a lot of physicians at the time say that when they heard about that, it was like it shut down the hormones. Nobody prescribed. And to your point, like everyone just stopped talking about it
Mhm.
because they, with a megaphone, they went out and said, don't take it. It causes cancer. But now that those findings have sort of been debunked, no one's coming out with the megaphone. It's just the women who are suffering, and then a handful of physicians, functional medicine, OB-GYNs who treat menopause, but no one's coming out with the megaphone to say this is not exactly the case and as harmful as we thought, and here's what the options are now. So I kind of think it's interesting when I heard that. I was like, that's so true, because it's really been over the course of the last couple of years that menopause is getting more of sort of the time and the voice that it needs. And like we were talking before, I'm 50 years old. I started going through perimenopause at 43. And for the first 5 years, so until 48, I couldn't find anybody willing to treat me for all of my symptoms until I finally found you. And I will share. So, I am a patient of Dr. Lambert's, and thank God I was fortunate enough to find her, because I won't bore you with all of the story of my menopausal journey. But for the first 5 years, I had every symptom you can imagine. And it was like, they came on like someone's flipped a light switch. And it was really horrible. And I felt like a shell of myself. I was like a shell of a human being. And I thought to myself, I'm in my 40s. Like, this is not how life should be. I should be vibrant and enjoying life and full of energy. And it wasn't until I saw you the very first time and I sat down and you heard me and you listened to my entire story of the last 5 years and everything that was going on. And you said to me, your exact words were, it's medical malpractice that no one has prescribed HRT for you. And I remember that line. Here we are, 2.5 years later, because I thought to myself, it is. It really is. I can't believe that no one has prescribed hormones for me, because I just was so sick. And, here I am 2.5 years later. I feel like a new woman. I feel wonderful. It's been a journey. It takes a little while to get there, which we'll talk about. But I am so grateful for you and for all that you have done for me, because I can't even imagine where I would be now if that wasn't the case. So, with that being said, let's talk about HRT, and let's talk about sort of what your thoughts are on it, because obviously you've been prescribing it for years. But I know a lot of women are still very hesitant to take it. And I'm not saying that I think every woman should have it, but I think it should be an option that is available to women.
Right. I agree.
So let's talk about sort of the different types of HRT and how you feel about it, about hormone replacement therapy in general.
Yeah, I think that now, I mean, even back then when they were prescribing a lot of the synthetic artificial hormones, being in New York City, I had a lot of patients who sort of demanded, more natural.
Yeah.
And back then, there were products on the market that were what we call bioidentical, meaning that they're hormones that look chemically, molecularly, just like our own hormones. They're identical to human hormones, not horses, and
Right.
contrived in a laboratory. So by and large, it's turning out that those are safer all around. There's less side effects. The Prempro is pretty safe. I mean, they have not taken that off the market, but why not give a little bit safer? I think there's more heart protection. When I say I think, it's from reading research, not just,
Right.
you know, but yeah, so the bioidentical progesterone is a little better on the heart profile, and the estrogen is a little safer in the breast tissue. And in fact, now they actually were studying the estrogen part of it, called Premarin. After that, Women's Health Initiative in 2003 came out showing that maybe there was less breast cancer in the estrogen only, the Premarin. And they kept studying that. They didn't talk about it, but they kept studying it. And they published the findings after 20 some years they published those in the Journal of the American Medical Association. And it still holds true that the estrogen group compared to the general population had less breast cancer, but it
Wow.
wasn't a statistically significant number. So that's why they're not saying anything. But one thing we know, it's not the estrogen.
Right.
It's, the probably
Yeah.
those artificial progesterones, if anything. So anyway, trying to do more natural, less pharmaceutical. I've always leaned towards prescribing bioidentical hormones in general.
Okay.
I think the best thing about them is that, we can tailor them to women's needs because I don't think two women have the same experience in menopause.
Right.
Menopause can affect you head to toe, and perimenopause is sometimes the worst because the hormones, not only are they going towards depletion, but they're also swinging. So
Yeah.
you could have very high and then low numbers, and that gives a lot of issues, as you know.
Yes, as I know all too well. Let's talk about some of the symptoms of menopause that you see maybe most frequently. I mean, I know I think there's now that I feel like I'm an expert in menopause, just of all the stuff that I've been dealing with and reading and knowledge for my own self. But so I think there's so many symptoms of menopause that people don't realize are symptoms of menopause, like frequent UTIs and maybe some cardiac issues and things like that. But then there's the really frequent ones that you see all the time. What are the symptoms of menopause that you see in your office maybe most frequently?
Yeah, and it's different. Perimenopause is where the hormones are on again, off again, and swinging. So in perimenopause, and I usually say they affect you head to toe. So I go
Yeah.
from the top to
Yeah.
yeah, perimenopause often gives the most mood swings, like you're feeling overwhelmed. It's hard to focus, hard to, just you have a short fuse, you're a little more snappy. Sometimes you just get a little down and brain fog. That
Yeah.
happens all the way through.
Yeah.
And a recall, our brains aren't as sharp. And trouble sleeping, that's a big one. You
Yeah.
just don't get into a settled sleep or deep sleep and you toss and turn a lot. Or frankly, some women are up in the middle of the night and up for hours with, it could be like a panic attack because you get adrenaline rushes then.
Yeah.
You get night sweats where all of a sudden you're just drenched. It could be a little warm, or maybe it gets as bad as where you have to change the sheets and change the nightgown and all that. And not everyone experiences all of these. They could be mild, they could be severe. You could have all or none or in between. Everyone knows about the hot flashes, and that's really the only indication for using hormones now is a hot flash because they don't have a pharmaceutical treatment. But if they did, they'd probably take that away from the hormones too. But anyway,
Yeah.
so hot flash is like an internal heat, like it comes from within. And it could be just a little warm, or you could have like burning hot sweats followed by chills. I mean,
Yeah.
and the gamut is in between. So, yeah, they can be pretty annoying.
They're very disruptive, right?
Mhm.
I mean, I remember my mom complaining of hot flashes and thinking to myself, what's the big deal? Like, you just get a little hot.
Right.
And so I started experiencing them myself, and it was like nothing that I've ever experienced before. And not even like, during pregnancy, there's hormonal changes, and like you get like sort of a little the night sweats, and you get some temperature changes. But a menopausal hot flash, for those people that get it, I mean, it is like the devil is trying to release from your body and like nothing you've ever experienced before. And it is extremely disruptive, especially if you get them frequently during the day, or if you get them at night, forget it. It's waking you up and you are like just wide awake out of your sleep and can't fall back asleep. And the whole thing is a mess. So
Right.
those, they're bad. They can be bad.
Yeah. And those are more often and more intense, I think, in premenopause, what I
Yeah.
call peri. That's the
Yeah.
surrounding time of menopause. And that's from the swinging up and down. But the other things that happen during a lot of like worsening PMS, just really fatigued right before the period, really snappy, like
Yeah.
that
Yeah.
I hear a lot. And then as the periods get less and less and you start skipping, that's when your hormones are not as much swinging, but they're down, like they're running low, if not zero.
Yeah.
And that's when you get more intense, tiredness, you lose your get up and go motivation, that kind of thing. And you can get more brain foggy, more achy. A lot of women going through that perimenopause switchover, they get frozen shoulder or tennis elbow. That's pretty common because
Yep.
when the hormones plummet, they contract the ligaments and it's, that's a pretty annoying issue. But once you settle into menopause, you just get usually an overall achiness or stiff or, just you lose your get up and go. And that's what I
Yeah.
hear a lot. And at any stage, adding back the hormones can help. But I find there's some herbals, vitamin supplements that really, really save a lot of women from the swinging hormones.
Okay.
Yeah, we're taught in our textbooks, the OBGYNs, we can't fault them because this is what they're taught. Give
Yeah.
birth control pills or give antidepressants. That's what we're taught.
Right. Yeah.
And if we don't want to go that route, because those often have side effects of their own, I usually recommend there's a couple of different vitamins that help to balance and stabilize and fill in the gaps when they go too high or too low. It blunts when it goes too high and fills in when it goes too low. So these are really great herbals that I've come to rely on. And now you can find them in one capsule. They used to be, all
Oh.
different supplements. So I usually recommend there's a product called FEM Rebalance.
Oh, okay.
And it's by a group of women naturopaths. Those are doctors who prescribe just herbals. They're called
Okay.
naturopaths. And they created this one product, and I use it often in my recommendations. And it gets a lot of women through perimenopause. Often I usually do prescribe some bioidentical, like light doses, depending on what their symptoms are and relatively how depleted they might be.
Yeah.
So that's in the premenopause, like when you were saying in your 40s.
Yeah.
Thank you so much.
That's great. I mean,
Yeah.
I that's a great recommendation. What about, are there other things besides the supplements? So, when you see a patient and, they come in with a host of symptoms, besides offering them HRT and possibly like the rebalance, what are some other things that you go to help them? Like, do you talk? I mean, I'm sure it's like the gamut: sleep, diet, exercise, like all those things. But
Mhm.
give us a little bit about what you think your recommendations are to women.
Yeah, it's often not just here, take this pill or this
Right.
vitamin, because as you probably know, there are triggers. Sugar can make the anger and the sweets give you more anxiety and adds to the flashes. And so, yeah, of course, it's a sort of wake up call. That's what I say in your 40s. It's a wake up call that you want to start eating more healthy, exercising, giving yourself a little time to decompress. Often women are giving and giving their kids, their husband, their work, everything comes first. And I always tell my patients, pencil yourself on your to-do list.
That's a great suggestion.
Put yourself in there somewhere, like massage or a little deep breathing or a yoga class on the weekends. There's always things that need to be done, but you have to prioritize yourself. And then I think what we do in our 40s, 50s, 60s will impact how we age.
Yeah.
Like if you start cutting out processed foods and sugars, not only you'll feel better, but you'll age better. Like
Yeah.
in your later years, less incidence of arthritis and heart disease and so on, depending on how you sort of start taking a more healthy approach. And, when we were younger, we could eat, but we have to call, the sweets and the processed foods, like that's for kids. we,
Yeah.
we're not able to indulge, maybe a little bit here and there. Of course, you got to live, but
Right.
generally just foods that are one ingredient. We call them whole foods
Right.
instead of a whole list. Anything from a package or a box or a bag, they often have all kinds of additives and trans fats and things that make the menopause much worse. So I
Yeah.
do run down, some just little easy things to incorporate. And just real fast, one thing that, every woman experiences, just about everyone, is some weight gain, which
Yeah.
we become insulin resistant, which means we're going to get a little belly if we eat one little strand of pasta.
Exactly.
It's
It's
that bad.
terrible.
It's that bad.
Yeah.
So, so we can't go on in life with just eating, salmon and lettuce and a few soybeans for lunch. This is ideal for not gaining weight, but it's hard to live that way. So I always say, start using palm size, small portions of
Yeah.
starches instead of the, bigger portions, and always mix with lean protein. Like if you have pasta, small portion with some turkey meatballs or chicken sausage or something that's lean and protein, shrimp, chicken.
Yeah.
Yeah. So just knowing how to eat a little can help keep off that. I call it the menopause 20 because that's the average. Women
Yeah.
can do nothing and gain 10 to 20. But if you exercise and you change your diet a bit, you can at least keep some control over it.
Yeah. I had to radically change my diet, like
Yeah.
completely, like everything about it. What I eat, how much I eat, when I eat. And again, like I said, it's a process. It's taken me years,
Mhm.
but it's amazing how much better I feel when I eat a whole food, clean diet versus, I say everything in like 80/20. So, I give myself a day or two to fall off the wagon and cheat, but I feel so much better when I'm eating clean. And it's just because of how my body is now. It just can't even tolerate everything that all the junk that I want to eat. Just can't even tolerate it anymore.
Right. And a lot of them are triggers for hot flashes and moods and
Yeah.
achy. It'll make the joints ache. It's crazy.
Yeah, absolutely.
Yeah. Just doing little changes like olive oil instead of vegetable oil and snacking on, almonds and dark chocolate instead of cakes and cookies and
Yeah.
just changing over little by little. There's some easy things. You mentioned at one point Mary Claire Haver. She's
Yeah.
a big podcaster and
Yeah.
I always recommend her book called The Galveston Diet.
Yes.
And she has lots of great recipes and lots of great ideas for how to eat in menopause. So I recommend that a lot. And we also have a nutritionist who works with us in the office just because weight is such an issue. So,
Yeah. It is such an issue. And not only is weight such a huge issue, I feel like the diet has helped with so many, to your point, has helped with so many other symptoms that I didn't think it would help with because, what we are putting in our body is really everything. How we are fueling ourselves and what we're putting in affects every aspect of our health.
mhm.
So it really is super important to focus on eating a clean, healthy diet when especially when you're not feeling well, because it will help everything, I think. I will say I did try all that. For me, it was the HRT. And again, as you know, it was a very low dose, but I tried everything possible for 5 years. You name it, I tried it. Everything, holistic, functional medicine, natural, supplements, vitamins, everything. And it wasn't until I had just that little bit of HRT that all of a sudden everything started to feel better and fell into place. So let's talk about that because there are so many versions of HRT available. There's a patch, there's oral, there's troches, which are like lozenges. I think there's implants. Is there any that you feel are safer or better than others? Or do you think it's just really patient dependent?
Yeah, I do. I often will also lay the options out on the table, and it depends on what somebody's more comfortable with. I've had patients who walk in the door and say, I want pellets, so
Yeah. And pellets are something, what are pellets? Those are something that get implanted in your under the skin, right?
yeah, they're little compressed tablets. Everything I prescribe is bioidentical, so that, they're all produced from plant sources and modified in the lab. So they are synthetic, but they're made to look exactly like our own natural hormones. So in that sense, they're more natural. But out of that group of bioidentical, there's the cream. There's a compounded cream. Usually I might put together estrogen, progesterone, testosterone. Some have,
Okay, hold on. I'm going to stop you there because I
yeah.
don't know if my listeners understand what you mean by compounded cream. So let's talk about that for a minute because what you can do is specifically for each patient, you do a workup on them and you get their blood work and you see where their hormones are. And then after that, you basically you look at their blood work and then talk to them about where they might need some replacement. And then you have a compounding pharmacy, which there's compounding pharmacies all over the country, but a compounding pharmacy is something different than like a CVS. It's a pharmacy that a lot of naturopaths use and that sort of thing, but they actually make the medication at the pharmacy. So this is a place where you can prescribe exactly the levels of, like you said, estrogen, testosterone, progesterone, whatever you want in the cream and really make it very specific to that patient, correct?
Right. It's custom made.
Custom, yes.
Yes. Yeah, custom made for the person. That's why it's hard to teach other doctors. It's just sort of something you develop as you have experience, and they don't teach doctors about custom pharmaceuticals because they're not FDA approved, but they
Right.
are federally regulated. But I like them more because we can pick and choose. Like a
Yes.
lot of things that you get from CVS, they'll take from a stock bottle
Yep.
and just put it in your little medicine jar and hand it to you. And it's just one size fits all, usually, which
Yes.
doesn't really serve menopausal women. Usually they need a little more of one and less of the other. And depending where they are in the perimenopause, we want to go up or down on the doses. So the cream gives you the least effect, and the creams are compounded usually. And
Yeah.
then if somebody's not comfortable with using a compounding pharmacy, I'll usually prescribe a bioidentical estrogen patch.
Okay.
And estrogen in anything that goes in the skin, like a cream or a patch, or even the lozenge that goes directly into the like mucous membranes in the mouth. Anything that goes that way versus swallowed in a pill is safer. So we call them transdermal because they go through the skin and they're less likely to give any risk to the blood clotting
Okay.
factors. Where a pill, even a birth control pill, can have a little risk for causing a stroke or a blood clot in the lungs or so on. And that's what's given a lot of doctors pause because they worry about older women. And as we get older, we have risk for strokes and blood clots anyway. But using the products that go through the skin don't have the same risk.
Right.
So I am comfortable with any age, just introducing light doses of hormones where a lot of doctors are going to say, no, you can't use them in your 60s. No, you can't use them past 5 years. And all of that has to do with the pill form,
Okay.
not the synthetic, stronger hormones that we used to use. So it doesn't have to do with the bioidenticals. So that's just another way that the bioidenticals are safer still. So that's the cream, the patch, and then you mentioned the troche, or it's called a lozenge or troche. They're little lozenges that you let dissolve between the gum and the cheek. And it's just a matter of preference. It gives you a little more of a boost, a little more
Yeah.
kick. And then the pellets give the most effective, if the, and I usually don't jump to pellets. I'll use, the creams or the patches first. But if somebody's like, I can't get out of bed, I'm just dragging through the day, or just really impacted, I
Yeah.
might suggest, and then the pellets work more from within because they're released directly into the bloodstream. And those are little tablets we insert under the skin. And of course, I numb up a little spot on the hip and just make a little nick in the skin and inject underneath.
Okay.
And the tablets dissolve over 3 months. And we monitor the levels and we make sure, the levels are in safety reason. And they're just delivering usually an estrogen and testosterone amount.
Okay.
And we usually have to add progesterone to, balance it out with a progesterone pill because progesterone's a little oily. It just comes in a pill. And in a pill of progesterone, it's safe. It's not the same risk as estrogen in a pill. So a little complicated, but yeah, depending on what somebody prefers, that's what I'll prescribe.
Okay. So there's lots of options, which is
Right.
amazing. So let's talk a little bit about the hormones themselves, because I feel like a lot of people know estrogen, right? Because ever since we are young girls, we hear about estrogen. You don't really know much about progesterone, testosterone. I know there's like DHEA and all these other hormones that are involved, but maybe just real quick, I want to kind of go through the estrogen, progesterone, testosterone, and talk about sort of why they're so important to have in our body. Like I know from the little base of knowledge that I have, like and because I take progesterone at night, I know that that's really more of a calming hormone and it helps us sleep. So it's better to take it at night because then for those with menopausal symptoms that wake up and can't fall back asleep and it's protective and calming in that way and will help with sleep. That's my little bit. But tell us a little bit more about progesterone or why it's so important for us to sort of have it in our bodies.
Great. Well, back when they first started prescribing hormones, they found that giving estrogen alone, if you still had your uterus and didn't have a hysterectomy, using estrogen alone had a risk of uterine cancer.
Okay.
For sure. No question. It's not controversial. We knew that. There's a
Okay.
fourfold risk. And then they found that adding even a small amount of progesterone, there's a minimum amount we're supposed to use. But if you add progesterone, and they proved this by biopsying thousands of women, or at least hundreds of women, and seeing that there was absolutely no cancer risk to the uterus if you added the progesterone. So we never prescribe estrogen without progesterone.
Okay.
And there's like I said, a minimal amount. It's a specific, pill that you can get. Usually that one you can get from CVS because
Yeah.
it is just pretty much a one size fits all. But for women who can't tolerate it at the recommended amount, sometimes we'll prescribe it in a cream and divide it up and things like that. So we make it work. But progesterone is usually a calming. It can give you a nicer, deeper sleep. But it's basically, its main purpose is to just help balance the estrogen in the body.
Okay. Awesome.
That's the bioidentical progesterone we're talking about.
Yes. Yes.
Yeah.
Okay. And then what about, let's talk a little bit about testosterone because I think you hear testosterone, everyone automatically goes to males, thinks about men and testosterone. Maybe some people don't even realize that females have testosterone in their body, why it's important to have testosterone in your body. So tell us a little bit about females and testosterone or your take on it.
Yeah, sure. Yeah, well, it's an androgen, which is a male-like hormone, but our bodies, our ovaries do produce little bits. And testosterone it plays an important role, I think, in maintaining our muscle tone and our bone strength. It also contributes to our vitality and I call it motivation or get up and go. And when I replace women's testosterone, if it's running low, I usually do like a milligram up to maybe 5. I mean, we're talking little amounts because
Right.
men typically will use anywhere from 200 to 1,000. And when you hear about athletes using steroids, it's testosterone and they use in the 200 to 500 range. So we're talking about 1 milligram.
Yeah. We're talking about one, not
Not a lot.
two to
Yeah.
500. Yeah.
Yeah, but it can actually give you some bone strength, and I call it stamina or
Yeah.
vitality, a little mental clarity. It could give you some muscle tone if you work out, because our muscle very nicely turns to flab. It does
Right.
when we
Right.
go through
Right.
menopause.
And what
So,
about, and sex drive as well, right?
oh, absolutely.
Yeah.
Yeah, for
Which
sure.
is,
We have no chance of having sex drive, I think, without the hormones.
yeah.
And yeah, we're, prone to have a little libido before we ovulate, the hormones are climbing and strong, but we stop ovulating after a certain age. And most women have absolutely no interest.
Yeah. Right.
Even though we do continue to produce a little bit of testosterone even after menopause. That's why women they get the little facial hair they have to pluck, and because
Yeah.
that's the only thing that's circulating is testosterone at that point, even though it might be a low amount. And I think it's a combination of estrogen, testosterone. When they're in good balance, you can have some decent libido.
Yeah.
Not like men, but enough
Right. Right.
like willing participants.
Well, we can have like 1 milligram versus 500 milligrams
Right,
worth of
right.
libido. Yeah.
It'll give
No,
us a little something.
yeah. Yeah. No, I think that's important because I think more and more, or I guess I'm hearing more about testosterone, learning more about it, seeing it on social media, how important it is in females, to have just that little bit. And that is definitely coming from compounded pharmacies because the pharmaceutical versions are, to your point, in very high doses because they're meant for males. No pharmaceuticals companies are making testosterone for women currently. And a lot of times when the male forms are prescribed for women, they're getting denied. So you kind of have to go through the compounding pharmacy. But I feel like a lot of women know about estrogen and progesterone, but maybe not so much about testosterone, which is, could be important, especially to your point, if it's not just the sex drive, but if it's vitality and focus and motivation. I mean, I know one of the biggest things for me was every day I felt so like, oh, like I just didn't want to do anything. Like I just didn't have that. And I'm a pretty excitable, energetic person. So to go from feeling, so enthusiastic about life and having that get up and go every day to all of a sudden feeling so unmotivated to do anything ever is really hard and really, really difficult to function.
Yeah.
So I think it's important for people to understand that just a little tiny bit of getting some of that hormone back in your body makes a huge difference.
Yeah, I think so.
Yeah.
And especially, when women are more in high powered jobs now,
Yep.
lawyers, doctors,
Yeah.
business women, if you don't want to have to retire in your 60s and 70s or even 70s. You want to keep going. And then you just really need that extra little push from the hormones. It can make all the difference.
Absolutely. And do you have patients? Because I know you mentioned like, some people say, oh, can only be on them for 5 years. So do you have patients that start on hormones in perimenopause and just keep on going for a long time? What is,
Yeah, absolutely.
yeah.
Yeah.
I mean, because right now there's really no recommended time frame that you have to be on them, or, it's, you mentioned Mary Claire, but I know she says, she's like, I'm going to be on them forever, for herself personally, because,
Right.
she went through her own struggle, and I guess you just have to sort of see how you feel. It's a journey, right? You really have
Yes.
to kind of see how you feel and make that decision for
Yeah, I
yourself.
say we'll evaluate year to year.
Yeah.
If you want to back off on them, that's fine. It really depends on how active you want to be, how
Yeah.
vibrant you want to feel. Not that you're going to shrivel up and whatever, but as time,
But kind of, that's
I
what
don't
it's
want to
like.
be, yeah, I don't want to be too drastic, but no, it helps. It helps to just keep you going if you want to be active, and especially if you have, you want to keep working and keep your brain functioning at its best. And we're not talking about, high doses of
Right.
hormone. It's
Right.
just enough to keep the circulation from dropping to zero.
Yes,
Yeah.
exactly. So tell us a little bit about your practice. I know you have a practice called the Balanced Woman. It's in Ardmore, Pennsylvania. Tell us a little bit about your practice, because I know you have, like you said, you have a nutritionist, you have, you are a medical doctor, an OB-GYN who also has functional medicine. You look at the whole person, you're looking at root cause of things. Like your practice is, I think, a little bit of a unicorn. Like there's not many practices that do that, so maybe tell us a little bit about what you offer, and maybe some advice that you might have for, women who are listening that can't come to your practice in Ardmore. As a physician, knowing how difficult it is to find the right care, do you have any advice for women listening, what they should be doing?
Yeah, well, first of all, a lot of times I tell my patients, you can't blame the doctors because this is what they're taught.
Right.
And I keep up with all the conventional literature, the research that comes out in our journals. We don't not I think no doctors really get their information from Google, but we get the
Right.
journals that give us the latest and greatest, and it gives us the data, because you want to know, well, how do you make this statement? But I don't know, something's happened lately, like over maybe the last 5 to 10 years, that they just make statements now saying
Yeah.
that don't use hormones. It could do this or it could do that. And when you say, well, where's the data? It's just a statement,
Yeah.
and I'm not understanding that. So it's tough to get doctors to be convinced. And they did stop teaching hormones and menopause really in the 2000s when that research study came out. And there's no good reason for that either.
Yeah.
But you could ask your doctor to prescribe the patch. It's technically only indicated for hot flashes.
Okay.
But if they're willing, a lot of family doctors now are actually being taught to give the patch and the progesterone. It's
And
tough.
when you say the patch, that is the estradiol. It's,
Estrogen patch,
yep,
right?
estrogen patch, and then the progesterone pill
It's
to go
tough.
with it.
Even as of this year, I think I've seen more doctors in the area starting to offer the bioidenticals. So, practices like that might be cropping up. And
Okay.
yeah, it's unfortunate that there aren't more doctors like us, out there teaching about nutrition. Even when it comes to diabetes, you could be sent
Yeah.
out with all kinds of prescriptions and no one's talked to you about maybe you want to give up your donut in the morning. It's
Yeah.
just the way
Right.
doctors are in this country. Yeah, so I've always tried to be, a little bit more root cause. And before, it was functional medicine, it was called complementary, where we use
Oh,
vitamins. And I've sort of been raised on vitamins because my dad was in the cancer research world and knew of a lot of benefits to certain vitamins. So even back in the 70s, when I was younger, we just grew up on, taking supplements. And then I remember, learning a little bit because you'd have to go to special courses. Back in the 90s, they called it botanical medicine. So,
It just keeps changing names for the
yeah.
same
Yeah.
Yeah.
So, I mean, there were some doctors like Andrew Weil, and
Yeah.
they would recommend certain supplements. And now it's a much more accepted field
Yeah.
where they call functional medicine, and your patient or your listeners can probably find functional medicine practitioners anywhere.
Yeah.
And those are just doctors who listen to your symptoms and try to find out the root cause, the
Right.
underlying problem. If you don't have good gut health, you're not going to feel great because all your serotonin, your good neurotransmitters are made in your gut. So,
Yeah.
they're going to go for the helping your GI to be working optimally, that kind of thing.
Yeah.
So those kind of doctors are more and more in the population. And I would encourage your listeners to seek them out, especially if, you want to just optimize your health for the future.
Yeah. Yeah. I think that's a great suggestion because to your point, there probably are more functional health physicians around than specific OB-GYNs who focus on menopause. And to your point, not that there's any blame on the doctors, but traditionally, if you go to your gynecologist, most of the time they don't have great answers for you when it comes to all your menopausal symptoms. So whether or not that's shifting, hopefully it is with maybe more training. But if you're not getting the answers that you need from your gynecologist, maybe seeking out a functional medicine physician, I think that's a great idea. Well, Dr. Lambert, thank you so much for joining me on the podcast today. I loved hearing all of the amazing advice and expertise that you have to share with us. I am very passionate about this topic. I think it is something that all women in midlife, whether they're going through symptoms of menopause or not, like we said, menopause is different for every single person. Some people will experience nothing, and some people are just wiped out from it. So, regardless, I mean, this is a conversation that is and a topic that I am very passionate about. And obviously, you are too, because it is your life's work. And you are doing so many good things and literally saving so many women's lives by what you do. So, I'm very grateful for you for that. So, thank you for being on and sharing with us today.
Thank you for having me. Thanks for getting the word out.
Absolutely. You got it. Well, thank you so much, guys. Thank you for listening. You can find Dr. Lambert's information in the show notes. She is at the Balanced Woman Medical Practice. And you can follow me at Suburban Warrior on Instagram, TikTok. And we will see you next week with another amazing Suburban Warrior here to share her story with us. Have a great week.